Hi, this is Scott Pop. This is the first video in my series of a self-treatment course that is going to be coming out. The broad overview in this video is to just give you an understanding of especially lower back problems, but you can generalize this to spinal problems. And so I want you to have as much knowledge as possible because I want the patient to have what's called an internal locus of control, meaning that they are actively involved in their recovery process. If a patient is actively involved and expecting to get well, they usually will, or they'll get well a lot faster. And that is always our goal. So, the first thing I want you to understand also is that do not compare your back problem to somebody else's. Each individual back injury has a unique set of characteristics. These characteristics are not the same as your friend who recovered in 2 days or 2 weeks or ended up in surgery. So don't even compare their treatment to you. Don't compare their recovery to you. Every back problem has a unique signature, and every back problem responds slightly different. Unfortunately, lower back disorders have a high rate of reoccurrence. It is our goal to minimize the chances of this reoccurrence. How do we do that? We want you to get well as fast as possible. This minimizes the alteration in movement patterns that happen throughout the body. When you have an injury, your body splints. It changes the dynamics of the gait in the lower back. It shifts stressors to your lower extremity, to your upper extremity, to your neck and shoulders. It can cause long-term changes if left unchecked. And so those changes can create stress like degenerative changes to the knee, the foot. It can create abnormal strains to the shoulder. Neck pain and headaches are common. And then the lower back becomes essentially destabilized, and this can be a cascade in the wrong direction. Your tissue health, your lifestyle, your job and occupation all play a role in the recovery process, but your unique individual situation is different than somebody else's. And never accept long-term treatment programs from other chiropractors or practitioners, because I will tell you that in so many cases, it's very unpredictable the length of time it's going to take for your recovery. I only treat 2 weeks out, usually at one time. I try to get a good estimation if this is a severe injury, a mild injury, and we want as minimal amount of treatment. We want the maximum amount of effectiveness, and our goal is to see you recovered and not leave me as a permanent patient. We don't want you to be one of those patients that has chronic residuals, that their back goes out every 3 months and ends up on the floor or needing treatment or whatever, but those cases do happen. And I'm not even going to tell you the statistics, because that is why so many people have doctor's visits with lower back disorders. In fact, they're the #2 reason to going to a doctor behind the common cold. So they're almost universal, just like teeth problems are almost universal. But how you treat them and how you approach them has to be uniquely yours. So we want it to resolve as fast as possible. There's 3 levels of care. There's the conservative side of care, which should be your first avenue of care, which is either chiropractic, acupuncture, physical therapy, massage, whatever you like to do, exercises. Those are the conservative approach that should be done in almost all cases, except in cases of trauma or cancer, infection, things that are more serious in nature. If you fall off a two-floor building and land on your back and we suspect there's trauma involved, go to the emergency room. That would be the case for a higher level of care. The mid-level of care is more like the steroid injections. They're not the surgical, they're not the conservative. The risk is higher, but still you're not at that really, really high level of risk of the third level of care, which is the most expensive, the most invasive, and the most risky, which is surgical. And surgical is only necessary in a very small subset of non-responding disc problems, instability problems, other issues. And so we reserve that for the last. We don't go into imaging in this first phase of care. Imaging, especially with x-rays, are almost completely useless. Don't let somebody talk you into using imaging as the reason for lots of care, because there is very little to no correlation between the x-ray and your necessity of care. MRIs are actually a much better image, but there again, they should be done in the initial stages unless there is some sort of pathology that is expected. We only jump off the MRIs in the 4 to 6 week category where the patient is not recovering or actually regressing, which is usually the minority of cases. We don't want to rack up unnecessary costs and unnecessary imaging for you that may cause risk. X-rays are using radiation, so we don't just jump off to those without having significant reason to do that. The correct goal is to always respond and resolve the problem as fast as possible so that your back doesn't become unstable, it doesn't decouple from the upper extremity, it doesn't change your movement patterns. Muscles are not shortening and lengthening and changing how you move, because that is going to create long-term problems that we're always trying to avoid. We're going to try to find the proper treatment. And so there's always different treatments even in chiropractic care. There's high velocity manipulation, there's low velocity manipulation, there's stretching, there's exercises, there's myofascial work, there's other things, diet and lifestyle, nutrition factors that we have to take into incorporation. So each back problem is unique, and what works for one person may not work for another person. And just remember, recovery is never just one thing. It is a multitude of things. And so you are in the driver's seat. You have to look at the big picture in your life. If you're not getting enough sleep, if you're not drinking enough water, if you've been sitting too long. Sitting is a nemesis of lower back problems, not so much lifting. People think that lifting brings most people in. No, it's really sitting for a long period of time, because the disc in the lower back is under the greatest pressure sitting, and it's acting like a tourniquet. It basically shuts off its nutrient supply in that area. So we want you to be actively involved, understand these broad parameters, and in each little video that we're going to present, we're going to talk about some unique aspects of the exam, treatment, specific types of back injuries, the disc, the facet, the muscles, the myofascial, movement patterns, things like that. So I hope you enjoy this video series that we're putting together, and it helps you in understanding your recovery and what tissue is the locus of injury for your specific case. So thanks for watching.